Hi, everyone, and welcome to the fourth and final session of the Flourishing Futures Conference, Ecological Relationships for Whole Person Health, Awareness, Attitudes, and Actions for Wellness. I'm Brian Berman, president of the Nova Institute for Health. Nova is a heart-centered think tank that takes action for the health of people, places, and planet. We have an amazing lineup of talks this afternoon, and I'm looking forward to a rich and fruitful discussion amongst all of us at the end. At a time when there is great urgency to make change in the world, it's so important to bring together such rich and talented groups of people from different countries, different disciplines, and different walks of life to share perspectives, listen, and learn from each other. In thinking about this session, I asked myself, what do we mean by ecology? What do we mean by whole person health? Ecology is loosely defined as the study of organisms and how they interact with the environment around them. How do organisms interact with the living and non-living factors around them? What do organisms need to survive and thrive in their current environments? Whole person health asks the same questions. In its fullest sense, it embraces this concept, going from the health of the individual across the lifespan, from birth to death, from twinkles to wrinkles, and going from the individual out to the community within which that person exists and interacts, and of course, out to the greater world that includes other species, plants, the soil, and the planet as a whole. Both terms point to complex interactions that are multi-directional and impacted by many things. The stress that people are under at this time, from the tsunami of chronic disease to the growing mental health crisis, and the stress that our cities and communities are under, from social inequalities and unrest to poor air and water quality, and the stress our planet is under, from climate change to degradation of the soil, all point to interrelationships and connections. Our speakers today will explore some of this from different perspectives. Often, when I speak with others about the seemingly overwhelming mess we are in today, the question is raised, where do we put the needle? How do we even begin to make the perturbations that will have the needed ripple effects? I personally am inspired by Jonas Salk, who I respect as a physician who was responsible for great medical advances, the polio vaccine, but just as importantly, who also thought more broadly than just medicine for creating what he called an epidemic of health. Salk liked to say that the answers are out there. We just need to know what questions to ask. I also believe his approach of looking beyond our own silos of expertise and engaging with others from very different backgrounds and domains of knowledge, be it philosophy, the arts, humanities, business, engineering, and beyond, will spark fresh thinking and ultimately provide us with answers. The Chinese have a character called Wei Ji, which means crisis. The character is divided into two components. The top part means fear and chaos, of which there is plenty going around these days. The bottom part of the character means opportunity. And we have the opportunity now and the moral imperative at this time of crisis to ask ourselves, what are our values and what kind of world do we want to live in? So now I'd like to get down to the awareness, attitudes, and actions of this session. I'd like to welcome and thank all the speakers in this afternoon's session who will be addressing the drivers of health and well-being. They are looking at solutions that will promote flourishing across scales of people, place, and planet. Solutions are found in the interconnected ecosystems that we as humans both create and interact with, from our healthcare system to our food system to the ecosystem of the soil which our food is grown and beyond. Evaluating and improving all systems, our ability to do so effectively will depend on our own approach, being mindful, aligned in mind, body, and spirit, and allowing wisdom, which I believe is a combination of both knowledge and love, to guide us in asking the right questions and optimizing the resources to transform policies and practices at this critical time in human history.